what is the role of an ACL in terms of athletic performance?
Yeah, so the ACL kind of sits right in the middle of the knee, and it's important, especially for pivoting and cutting activities, to stabilize the thigh bone and the shin bone together so there's not excessive movement there.
How does it commonly happen? Because it does seem so common, athletes tearing their ACL.
It's usually a pivot, a change of direction, or very commonly landing, and the knee kind of buckles in, and there's a force that goes across the knee that exceeds the ability of the ligament to stay intact, and that's typically how it happens.
What happens to an athlete after they tear their ACL?
Yeah. Typically, we see them based on the physical exam, the history of how they got hurt, and typically an X-ray and an MRI scan to confirm the injury and look for associated injuries. We make the diagnosis. Often we start them with our physical therapists and our athletic trainers into prehab. Then a couple weeks later, we follow with ACL reconstruction surgery, and then a long course of therapy afterwards to learn how to get the knee moving again, how to strengthen the muscles around it, how to walk on it, followed by then jogging, then pivoting, cutting, and then back into their sports.
What is the recovery timeline for an athlete after ACL surgery?
Typically at the early end, it takes about 9 months to return to full activity, but sometimes up to a full year depending on what was all done, what the demands on the knee are.
What advice would you give to someone who's aiming to recover from an ACL tear?
Stay locked in and stay focused, and really lean on all the resources that we have here at Titletown.